Welcome back to It's Personal, brought to you by Gunderson Lutheran. I'm Brian Gilberts. Each year there are about 36,000 flu-related deaths in the United States. The flu vaccine is the best defense against getting the flu. We're joined today by Bridget Pfaff, Administrative Director from Gunderson Lutheran Infection Control, to discuss the importance of getting your flu vaccine. Bridget, why should people get the flu vaccine?
Well, every year, nearly 36,000 people do die from influenza, but there's a lot more morbidity associated with the flu. People who get the flu wind up having to take a whole week off of work sometimes. I don't know many of us who can afford to take a whole week off of work.
So who should get vaccinated for the flu?
Anyone who doesn't want to get the flu this year should get vaccinated against influenza. People who have certain high-risk medical conditions, diabetes, people with chronic lung conditions, people with young children in their homes, definitely should be thinking about getting the vaccine. Grandparents, those over age 65, should consider getting the flu shot this year.
Okay, can you talk about the different methods available to be vaccinated?
Well, there are many different presentations of the flu vaccine. Most people are used to the standard flu shot that they've gotten for many years, but there are new formulations of the vaccine available now. There's an intranasal vaccine, there's an intradermal vaccine, and then there's a high-dose vaccine. Each one of these vaccines has different advantages and really some disadvantages. Some age groups aren't able to receive the intranasal vaccine, for example. But the important thing is it provides some alternatives and opportunities for people who want to get the flu shot, who maybe are afraid of needles. Maybe the nasal vaccine is the only way some children will take a flu vaccine. And the other important thing for people to be aware of is as you start to reach out into those other types of vaccines, their insurance companies may not pay for them. If they go to a standard everyday walk-in flu shot clinic, as you're seeing some signs crop up in our community already, or our walk-in flu shot clinic here at Gunderson Lutheran, you most likely will be limited to the standard flu shot, and that is because of insurance limitations on some of those other presentations. If people want to pay for their flu shot out of their own pocket, they might consider one of the other presentations, but most primarily focusing in on the standard flu shot and contacting your regular healthcare provider if you're interested in one of those specialty formulations.
So when and where can people get flu vaccines at Gunderson Lutheran?
Well, right now the flu vaccines are available in most providers' offices. If people are here for another appointment, we encourage them to think about getting their shot while they're in the clinic. If they would like to come to our walk-in flu shot clinic, which is a very fast turnaround time, we will have walk-in flu shot clinics in La Crosse and Onalaska, and then people can contact their local Gunderson Lutheran provider for other walk-in flu shot clinic times or dates. But here in La Crosse and Onalaska, that clinic will run October 1st through November 21st. Those clinics are going to be open in La Crosse and Onalaska from 8:30 until 6 p.m. Monday through Thursday, and then again 8:30 to 4 p.m. on Fridays. Again, people are also have the opportunity to get their flu shots in their own Gunderson Lutheran regional location and also at any of our express care locations.
Okay, we're talking with Bridget Pfaff from Gunderson Lutheran Infection Control about flu vaccines as flu season approaches. What are some of the misconceptions about the flu vaccine?
Well, there are the famous, I get the flu from the flu shot, I don't ever get sick so I don't need a flu shot. There's not enough vaccine for everyone, so save it for someone else. I still get the flu every year when I get the flu shot, but I haven't gotten it on years when I don't get the flu shot. Or I'm not at high risk, or I hate needles. And we really do have a lot of things to say about most of those misconceptions. And that is anyone can get the influenza virus, and anyone can prevent the virus from attacking their system by getting a flu shot each year. If you think you've gotten sick from the flu shot, most often people have already been incubating another virus and they get a common cold or another flu-like illness shortly after they've received the vaccine. People who say they never get sick, the one year that you do have to crawl in bed for that whole week is the year that you will remember your flu shot every year from then on. And of course, when you look at some of the other common myths or misconceptions is there are a lot of viruses that circulate during the flu season, and many people who think that, well, I still got the flu that year, we can look at that and say, it was probably some other virus rather than the flu shot itself.
And there's plenty of supply. I know a couple of years ago there was some issues with supply across the country. It seems to be enough for everybody now.
Yeah, we've seen some new manufacturers enter the market for flu vaccines and have seen some new opportunities, and the numbers of vaccines that are available has certainly grown in our distribution system in the United States, and that's been encouraging. Really, it is. Anyone who wants to keep from getting the flu this year should get their flu shot.
Okay. For someone who decides not to get vaccinated, what are some common symptoms of the flu?
Well, as I mentioned, crawling in bed for a week is that most common thing that happens when people get influenza, because they often feel like they've been hit by a truck. They have this sudden onset. People will say, at 10 p.m. I got a fever so bad and just felt like this onset of malaise. And it's not like people think of the stomach flu or throwing up and a GI upset. It's really feeling like you have difficulty breathing, that heavy feeling on your chest, making sure that people are thinking about the high fevers that can happen, be a result of flu, and what other complications there could be associated with that.
For someone who gets the flu, when should they see a doctor?
Well, certainly anyone should think about seeing a physician if they have trouble breathing when they have any viral illness. And often we think about if they have that initial period of fever and malaise and crawling in bed, that illness, and then they get better, so the fevers go away, and then they get a second fever a few days later. That's when we start to think that they might have a secondary pneumonia. So oftentimes people think, well, I have bacterial pneumonia, or I'm prone to bacterial pneumonia. That secondary pneumonia can set in after a virus like influenza has gotten in and taken hold in the lungs, done some damage, and then the bacteria can come in and cause some other problems. So getting better after you've had a virus and then getting worse again is often a sign that something else is going on.
All right. Any other information regarding the flu or the flu vaccine that people should be aware of?
Well, I think staying current on what's going on and what's going around. We saw a lot in the press this summer about not going to state fairs if you're a pregnant woman because of this swine flu that's circulating. We see some unfair labels to whether it's the swine or the bird flu, but being aware of what's going on in the current circulating strains so that you can protect yourselves. Hand washing is the #1 way to prevent the spread of any infection, and people can get back to the basics for infection prevention. Yes, get your flu shot, prevent your getting the flu this year, but then thinking about there's a lot of other things that go around, and how can you eat healthy, get plenty of rest, and do the preventative things that you need to, such as washing your hands to keep yourself from getting sick, are wonderful ways to be preventing all illness, not just influenza.
Okay, Bridget, thanks a lot.
Thank you.
For more information on flu vaccines, talk with your primary care provider or go to gunluth.org/flu.